Good afternoon, everyone, and happy World Water Day. My name is Abby Beho, and it is my pleasure to welcome you to the launch of Lake Health and Wellbeing's new public health campaign, You're Sweet Enough. This campaign is a collaboration between ourselves and the Ministry of Health. Before we proceed, I would just like to especially welcome and recognize some of the guests who have joined us today. So I would just like to welcome Dr. Marissa Carty, the Non-Communicable Disease Coordinator at the Ministry of Health, Michelle Sutton, the Health and Wellness Coordinator at the Ministry of Education, Vera France-Edwards, the Health Educator at the Ministry of Health, our colleagues from the media, thank you for coming, our friends, family, volunteers, and supporters. So welcome and thank you all for coming today. So we really appreciate your time that you've taken out of your day today to attend the launch of this campaign. So without further ado, at this time, I'm going to hand over to Iseline Phillip. She is our Advocacy and Research Officer, and she's going to provide an overview of the aims and objectives of this campaign. And then after Iseline, we're going to hear from Dr. Marissa Carty, who's going to give some brief remarks. And just to remind you that Dr. Marissa Carty is the Non-Communicable Disease Coordinator at the Ministry of Health.
Good afternoon to everyone. Thank you all for coming. So it's my task today to just give a brief overview of the purpose and objective of the campaign. For everyone listening in here, so the purpose of our You're Sweet Enough campaign is really to spread public awareness about the harmful health effects of consuming sugary drinks. So regular consumption of sugary drinks is found to be linked to weight gain and obesity, which are very common risk factors for developing non-communicable diseases like diabetes, hypertension, stroke, and various forms of cancer. In St. Kitts and Nevis, we know that non-communicable diseases are the leading cause of death among people in the Federation. In fact, according to national health data, non-communicable diseases account or contribute to 83% of deaths in St. Kitts and Nevis. While this is really alarming, it's actually not too surprising since we also see increasing rates of overweight and obesity in adults and children. The obesity rate for adults in St. Kitts and Nevis is 45%, which means that every 1 in 2 adults across the Federation is considered obese. Childhood obesity is also on the rise, with 1 in 3 children being either overweight or obese. So in light of these statistics, as a public health NGO, Lake Health and Wellbeing, we are committed to improving the health and well-being of our communities. And in so doing, we are happy to work along with the government in collaboration with the Ministry of Health to combat these health challenges. So today, we are extremely excited to launch the You're Sweet Enough campaign, which is developed to mobilize the public to make healthy choices and drink water instead of sugary drinks. This campaign will be ongoing for 9 months and will utilize various platforms to spread awareness and educate the public about the health effects of consuming sugary drinks. Everyone can look forward to seeing and hearing campaign messages via social media, music, videos, animations, billboards, and we'll also be engaging with the public through research surveys, information sessions, and events with experts, stakeholders, and other collaborators. While we have the government as they continue to focus resources on containing the spread of COVID-19 and planning for economic recovery, with this campaign, Lake Health and Wellbeing is committed to supporting the Ministry of Health in advancing its action plan for the prevention of non-communicable diseases in St. Kitts and Nevis. As the Advocacy Officer for Lake Health and Wellbeing, I'm especially looking forward to working with government stakeholders, other civil society organizations, individuals, businesses, and the public, as we're all committed to achieving sustainable and social development through health education and evidence-based policy development. I'll be available to answer any questions about the campaign specifically later in the program, but thank you all for listening. That's it for me for now. I will leave the podium and make space for Dr. Carty. Thank you.
A pleasant good afternoon to everyone. I would like to take this opportunity to thank Lake Health and Wellbeing for inviting me to just bring brief remarks on this, their launch of the You're Sweet Enough campaign. Within the last 20 years, the global public health sector has been responding to a health crisis that continues to challenge health systems in every country, that of non-communicable diseases and their risk factors. Non-communicable diseases are health conditions developed by individuals due to their lifestyle practices, such as unhealthy diet and physical inactivity, which can then lead to risk factors such as overweight or obesity. In the Federation, NCDs account for over 80% of all illnesses, disabilities, and deaths. Numerous studies have been conducted, and it has been determined that the incidence of obesity or overweight has progressively increased in every age group, thus becoming the major contributor to the development of NCDs, disability, and eventually death. The availability of healthy and safe foods is important to human health. However, studies have shown that the addition of unnecessary sugars in food items have contributed to adverse health conditions, including obesity, type 2 diabetes, and poor oral health. Consequently, there has been increasing concern for the added sugars found in sugar-sweetened beverages. A narrative review of the effects of sugar-sweetened beverages on human health, submitted to the Journal of Population Therapeutics and Clinical Pharmacology, found compelling evidence to support the fact that regular consumption of SSBs has a significant adverse impact on people's health. In addition, data from the Global School Health Survey conducted in St. Kitts and Nevis in 2011 indicated that over 60% of youths between the ages of 13 and 15 years drank a carbonated soft drink 1 or more times per day within a 30-day period. The survey also indicated that 40% of those youths were also overweight and obese. The World Health Organization proposes that sugar intake should comprise of less than 10% of total energy intake per day, and a reduction to below 5% of total energy intake per day would have additional benefits. Moreover, supporting evidence shows that a reduction in SSB consumption is associated with weight loss. Unfortunately, colorful beverages with flashy names and fruit-inspired flavors have become the choice of many of our children and youth in the Caribbean. Maisha Hutton, Executive Director of Healthy Caribbean Coalition, states that the Caribbean exhibits some of the highest rates of childhood obesity globally, and that excessive consumption of sweet beverages is one of the major drivers of obesity. Yet, most Caribbean children are still consuming carbonated drinks loaded with sugars on a daily basis. Consequently, the Ministry of Health recognizes that urgent action is needed in protecting the health of our nation and effectively combating the negative effects of excess sugar consumption. This can be accomplished by the development of a comprehensive policy to reduce the consumption of sugar-sweetened beverages in the Federation. The interventions recommended in the policy includes reducing access and availability of the beverages and public education to ensure that the general public is aware of the health risks associated with SSB consumption. As such, The Ministry of Health is grateful for the opportunity to partner with Lake Health and Wellbeing in this public awareness campaign. This campaign will afford the opportunity to share evidence-based information about SSBs to specific audiences regarding the harmful health effects of SSB consumption and to suggest healthy beverage choices such as water. The deceptive and manipulative marketing of SSBs to vulnerable communities and demographics such as children, youth, and young adults. Also, the need for implementation of adequate food labeling for sugar-sweetened beverages. And finally, in reducing accessibility of sugar-sweetened beverages by implementing measures such as sweetened beverage tax in an effort to build support from the public and private sector stakeholders. Therefore, the ultimate goal of this campaign includes increased knowledge about health problems associated with intake of added sugars in sugar-sweetened beverages and a behavioral change to reduce the consumption of SSBs. The Ministry of Health stands ready to support this campaign by encouraging the general public to drink some water, share some love, and tell somebody you're sweet enough. Thank you.
Now the fun part. So what I'm going to do now is I am going to launch our campaign material. So our campaign material is a range of different tools that we're going to be using to raise awareness of the harmful effects of sugar-sweetened beverages, but also to encourage the public to drink more water and fewer sugar-sweetened beverages. So the first thing that I'd like to showcase today is our jingle. So the jingle, we're very delighted that we've had our du jour as the vocalist for the jingle. So I'm going to play the jingle right now, so that you get a feel for what you'll be hearing on the radio for the next few months in regards to the campaign.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science sugar low in fat, but don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
So the message of the jingle, so just to break it down a little bit, is that you're sweet enough. You don't need to drink sugar-sweetened beverages. The World Health Organizations and many organizations from across the world have described sugar-sweetened beverages as a product that has no or little or no nutritional value. So really, they don't add any benefit to our health. So the message of the campaign is that you're sweet enough. You really don't need to drink these sugar-sweetened beverages. The message of the jingle and the campaign is that we want everyone to stop before you purchase a sugar-sweetened beverage or you select a sugar-sweetened beverage. Read the label on the back, understand the amount of sugar that's in that drink, and drink water instead. So what I want to do is just give you a quick example just to illustrate the steps that we're telling you about and to understand the information that you can glean from reading the label on the back. So last week, I went into the supermarkets. I picked up a sugar-sweetened beverages, a random one. It came in a bottle roughly the size of this. So that is 591 mils. I have the label here. So I read the back of the label, and it said, yes, it has 32 grams of sugar. And then when you look closely, it says per serving. And then when you look closely still, it says the bottle is 2.5 servings. So then when you do the math, you realize that by consuming that whole bottle of sugar-sweetened beverage, you're consuming 80 grams of sugar. So to visualize what 80 grams of sugar is, 80 grams of sugar is about 20 teaspoons of sugar. And that is literally, this is what you're consuming is that much of sugar in one drink. So that much sugar, like Dr. Kati was saying, the World Health Organization recommends that adults consume no more than 50 grams of sugar a day. And that one drink exceeds the recommended daily amount of sugar for an adult. So you can see that by reading the back of the label, you can get a clear understanding of how much sugar is within a drink. So we're encouraging people to read the back of the label, understand how much sugar is in that drink. Now, another thing that the Jingle aims to try and sort of clarify is that, sometimes when we go out into the community, people say to us, oh yeah, that's a drink, it has sugar in it, but it has no fat. So I'm okay, I'm good, I'm not going to gain weight. But we know from research that consuming sugar-sweetened beverages like the one that contains 80 grams of sugar regularly is linked to weight gain, obesity, and the development of non-communicable diseases. So we're really encouraging you to read the label, understand the amount of sugar, and then drink water instead. So that's the breakdown of the Jingle. In order to sort of highlight those messages, we're going to have billboards across the island, so reminding us to think before you drink and to drink water instead. So you'll be seeing these billboards going up very shortly. I think they're up already. So you'll be seeing those across the island to remind us to think before you drink and to drink some water instead. We also are going to have some TV ads as well. So this first ad is a good example of collaboration. So this animation is a collaboration between the Healthy Caribbean Coalition in Barbados, the Ministry of Health, Lake Health and Wellbeing, and the Taiwanese ICDF. So this project where we developed this animation was initiated by the Ministry of Health. It was animated by our team. And it's based on an infographic that was created by the Healthy Caribbean Coalition. And it aims to raise awareness of the dangers of sweet beverages in the Caribbean, and specifically this one on St. Kitts and Nevis. So I'm going to play it for you.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
Okay, great. So that's the TV ad that will be playing on the TV for over the next month or so, so to give people a feel for really the harms of sugar-sweetened beverages. So also, what we'll be doing as well is we'll have familiar faces, encouraging people to drink water instead. So the first familiar face, we hope you'll appreciate. The theme for this particular video is Take Care of This Temple.
I don't know where you are, but I want you to understand this, that St. Paul says, I want you to exercise yourself to godliness. What goes inside of you, the ingestion, what you are going to ingest in your system, is going to determine how you are going to grow in godliness.
I'm Pastor Lincoln Connor, the pastor with the mostest. Take care of this temple Drink water. You are sweet enough.
Sugary drinks are linked to weight gain, obesity, and non-communicable diseases. Remember, you're sweet enough. Drink water instead.
So the idea behind those videos is that we'll be having a series of those with familiar faces from the community, encouraging people to drink more water and drink fewer sugar-sweetened beverages. So over the 9-month period, so this is a fairly long campaign, we're going to be releasing new materials regularly, so new animations, new community leader videos as well, so that we can raise awareness of these messages and really have new and up-to-date material. And we're also going to have engaging and thought-provoking information sessions, and we're also going to have competition to really try and engage the public and get the public involved in the campaign. So lastly, the final thing is to say that we have a campaign website, so you'resweetenough.com. So you can go onto the website and you can find out more about the campaign. You can look at the videos, but you can also find out about any events that we have coming up as well. So that is you'resweetenough.com. So those are the first set of campaign materials. So you'll be seeing those on the TV, on the radio, and the billboards will be out, are out today. So you'll be seeing all of those as well. So those are the first set of materials. And I'm now going to hand over back to Iseline, who is going to moderate a Q&A, so for any questions that people might have from the media or whoever's in the room.
Thank you. Are you guys excited? Yeah, go on, hit the jingle again, right? You know, drink some water, share some love. It's catchy. Okay, so I'm here to respond to any questions that people may have about the campaign or the advocacy plans and anything like that that may have come out of the presentations that were done. Anything from the media that anybody would like to ask, or anyone from the audience, any curiosities, questions, anything like that. Have we just been so clear that, you know, there are no questions? No? Okay. Okay. Well, thank you all very much. I mean, just say one of the major outcomes that we hope to have, as Dr. Cardi kind of alluded to, is, you know, we're hoping that this campaign, it is a long-term campaign for the next 9 months, which should take us down to the end of the year. And we're really hoping that by the end of it, we're planning to have a positive impact on the public to raise consciousness about, you know, our health and healthy drink choices. Oftentimes we hear a lot about healthy eating, but, you know, we're trying to put a focus on drinking because we find that drinking these sugary beverages are really part of normalized culture and society, and we don't think about it. And so we're kind of really trying to shed a light on healthy drinking and encouraging people to choose water, which is actually the healthy drink choice. So when you leave here today, remember to drink some water, share some love, and tell your body that you're sweet enough, right? That's the catch, okay? All right. You'll be hearing a lot more from us throughout the rest of the campaign. Thanks.
Great. Thank you, Iseline. Okay, so I am just going to quickly just say a few thank yous, because as you know, campaigns like this don't just happen by mistake. So this campaign has been over a year in the making, so we're very proud to achieve this milestone of launching today. So I'd just like to take the opportunity to just thank all of those who've been instrumental in sort of the planning of this campaign. So first of all, I'd like to thank the leadership at the Ministry of Health for providing us with the opportunity to work with their health promotion team. In particular, within the health promotion team, I really would like to thank Dr. Marissa Carty and Vera Edwards-France for the many fruitful discussions, the brainstorming sessions, and all their enthusiasm for the project. So we really do appreciate it. We're also very grateful to the Taiwanese ICDF for their advice and support early on in the project as we created some of the campaign material. We'd like to thank Create One Media for their creative input, advice, support, encouragement, and their very professional photography and videography services. We're also very grateful to McPenny's for their printing services, and Carib Crafts and Grassfits for producing all the wonderful campaign materials like this t-shirt, the lovely banner, the billboards. Did a fantastic job, so we thank you very much. To DeJour and his manager, Dwight Alexander, we're very appreciative of all the time they spent with us on this project and assisting us with the jingle. I'm very grateful to Pastor Lincoln Connor for agreeing to take part in this campaign, so we're very appreciative of his time, his patience during the filming of his video, for his advice and also his willingness to communicate a very important health message. We'd like to thank Keisha Archibald, our unofficial consultant, for all her support, advice, her time, and her willingness to participate in the campaign as well. And we'd also like to thank all the volunteers who've assisted us along the way, especially over the past couple of weeks. We've been doing a public opinion survey, which is a very important part of the campaign in order to make it evidence-based. So we appreciate all their time as well, going out into the community. And we're very grateful for the advice, support, and input provided by the Global Health Advocacy Incubator, the Healthy Caribbean Coalition, Francine Charles of the Barbados Heart and Stroke Foundation, and the very wonderful Michelle Sutton from the Ministry of Education. And then we'd just like to thank the media, not just for coming today, but for working with us to create a platform to communicate a very important health message throughout St. Kitts and Nevis. So we thank you very much for coming today and for the opportunity. And again, thank you everyone today for coming. Thank you to those who've tuned in online as well. We do really appreciate your time. And well, as we've been saying, drink some water, share some love. Tell your body you're sweet enough. Let's all drink some water. Thank you very much. And that's it. Thank you very much. Short and sweet. Thank you.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science, sugar, low and fat. But don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
I don't know where you are, but I want you to understand this, that St. Paul says, I want you to exercise yourself to godliness. What goes inside of you, the ingestion, what you are going to ingest in your system, is going to determine how you are going to grow in godliness.
I'm Pastor Lincoln Connor, the pastor with the mostest. Take care of this temple. Drink water. You are sweet enough.
Sugary drinks are linked to weight gain, obesity, and non-communicable diseases. Remember, you're sweet enough. Drink water instead.